One.
Dog bites are devastating, especially dog bites to the nose. So join me as we go through a journey with Megan, who's a beautiful young woman who had a dog bite to her nose several years ago. It was quite devastating. And she's actually an RN as well. And so what we did is we did an open rhinoplasty and really reconstructed her entire nose and nasal tip, where she had significant injury to her nasal tip and dorsum. And as you can see, it's been a complete transformation in both her nasal tip as well as her function and dorsum. It looks amazing. So join me as Megan tells her story about her devastating dog bite. But there is incredible hope, and her reconstruction is amazing, and she looks beautiful. And I think the take-home message here is that be careful around dogs. Dogs are our best friend, and as you know, most dog bites actually are from dogs that are actually your own dogs, and that happens very frequently. So be careful. Enjoy this video as you learn both about complex rhinoplasty and so many other things, and Megan really explains that beautifully.
Hip cartilages have been transected and are avulsed, and there's no medial crura, especially on the left and the right. So we're going to have to reconstruct her entire nasal tip completely and columellar area.
Now 5 months after her rhinoplasty and dermal bridge of her nose. She had a dog bite in 2016, right?
Mm-hmm.
Yeah, so tell us about that. That was quite
so traumatic. I feel like I didn't identify with myself anymore. I felt so insecure. But now I feel so much more confident. I feel like I look like how I'm supposed to look.
And of course she's a nurse, so
yes.
She's very smart and very much of a professional that really. And you can see she had loss of her soft tissue triangle on the left, and really it was completely gone. And so we reconstructed that, and you can see it looks amazing.
Mm-hmm.
And you can see also on her base view, when I'll have you look up, that really had been shaped, and so we actually reshaped this whole thing. And luckily it was with her own cartilage, so that was really nice to do that. And then of course, on the side view, you can see, if you just look over here, you can see it, just turn out a bit. Yep. It looks phenomenal. And so we took her dorsal down and we shaped that. And then, today we're going to do a little canalog, and then we may in the next 6 months also do some more dermoplaning, but it looks
phenomenal. I'm very happy with it.
Yeah, it really does look great. And I'll tell you, the best is yet to come. This will soften more, and we'll just shape that, and then we'll probably in the fall when I see you, we'll do some more dermaplaning or something when you're not in the sun.
Yes, I'll avoid the sun.
Okay. All right, you rock. Thanks so much.
Thank you.
Thank you.